With us now to talk more about this is Dr. Robert Pearl, former CEO of the Permanente Medical Group. Doctor, it's great seeing you. I thank you for being with us. So RFK Jr. is being brought in by the president-elect to be a change agent for the industry. What do you think of his selection?
Well, let me start by saying I've never met Robert Kennedy Jr., and I have not had a chance to talk to him about it. But what I can read about his vaccine positions is extremely unscientific. Polio, as an example, used to either kill or paralyze 500,000 people around the globe each year. There's a year in which 3,000 people died in New York City alone. I have a great aunt who died from measles prior to the vaccine. These vaccines have made major advancements, and anyone who believes that they either cause autism or that they are not health generating needs to review the literature and see all the research that's been done. There's not any credible evidence of that. At the same time,
I'm sorry, Doctor, I just wanted to ask you because there is a difference, is there not, in the type of vaccines that are used. So what has been used to deal with measles and with polio was one type of vaccine, and then there are other types of vaccines. And Vaughn was talking about these preservatives in vaccines. Are there different types of vaccines?
Well, there are different types of vaccines. Polio is a good example. There's been two vaccines in the past, one using dead virus and one using live virus. We no longer use the live virus, and that's an example of different kinds of vaccines. The preservatives do what the word says. They preserve the vaccine, and that's a different question. That's not a different class of vaccines. And of course, we have what's called the mRNA vaccines, which are completely different. The ones for COVID, which used a scientific process and not the actual virus itself. So yes, there's a lot of variation amongst vaccines, and the FDA does a very good job of testing these, demonstrating the safety. Polio is a great example. It essentially has been eradicated everywhere except for 3 nations in this world, and the result has been remarkable for the health of our population. People forget that these childhood diseases killed and maimed so many people. We've forgotten it because they've been gone, but I'm very afraid, particularly as new viruses come along. Mpox right now, we've seen coming out of Africa. We have the avian flu that's sitting in cattle that could easily mutate and go to humans. And I believe that we do need to have a very aggressive vaccine approach in order to save hundreds of thousands, if not millions, of American lives in the future should a problem erupt.
I'm just wondering, Doctor, what's the difference between a vaccine that has been proven and has been utilized for, in some cases, decades, and then an experimental vaccine? When they say it's an experimental vaccine, is that a different kind of product than one that has been utilized for decades?
All an experimental vaccine means is that it's new and it's still being tested. COVID is a great example. We didn't have that virus, so there was no way to have a vaccine against that. Each vaccine is specific to the particular organism. That's how it is created. And the FDA has a very rigorous process of testing experimental vaccines, meaning just new vaccines, as it does, by the way, with every drug that is submitted for evaluation and approval. But these other vaccines, the polio vaccine, the measles vaccine, these have been used for decades with tremendous safety, and we have documentation of the millions of lives that have been saved.